An occlusal splint, commonly called a dental guard, is an orthodontic device that relieves symptoms of teeth grinding, TMJ disorders, protects muscular and anatomical structures, and even improves sleep problems like snoring or sleep apnea. It's an appliance that fits over the dental arch, usually the upper one, and prevents the chewing surface of the upper teeth from making direct contact with the chewing surface of the lower teeth. It also guides the muscles and mandibular joint into an adequate rest position, helping facial structures to relax and relieving muscular tension and pain caused by a clenching jaw or grinding teeth. Occlusal guards can be worn as needed, although most people wear them during sleep. Custom dental guards are occlusal splints made by the dentist. They fit perfectly in your mouth and have personalized features to address the specific circumstances of each patient. This is the ideal type of occlusal splint for people with clinical conditions, such as bruxism, snoring, sleep apnea, and temporomandibular joint disorders. They are way more comfortable than any other type of dental splint, but you must go to a clinical checkup to get one, and depending on your particular needs, a custom-made night guard might be expensive. Over-the-counter mouthguards are standard appliances designed to fit almost all types of dentures. You can find them in drugstores and even supermarkets, and they are fairly affordable. However, they might not be the best option since they are not customizable, so they won't fit properly and might cause discomfort. They are also not recommended for teeth grinding since they are made of soft materials that could stimulate the chewing impulse, worsening bruxism and jaw clenching. There is an intermediate option between OTC and custom dental guards, the boil and bite mouth guards. These are partially customizable. They are made of a thermoplastic material that can be softened by submerging the dental guard in boiling water. Once the material is soft enough, you should place the guard on your mouth and bite it firmly until your teeth make an impression on the material. After that, carefully remove the guard and submerge it in cold water to harden the thermoplastic material. Once the mouth guard is completely hard, you'll have a slightly customized occlusal splint. This type of occlusal splint is good for athletes and contact sports practitioners since it provides good protection against blows and crashes, but it's not recommended for teeth grinding or TMJ problems. TMJ splints are special appliances designed to guide the jaw joint and chewing muscles into the correct position. They considerably reduce the symptoms caused by TMJ disorders and help re-educate the maxillofacial structures to function properly. There are different types of TMJ splints. 1. The stabilization splint, also known as a permissive splint, prevents harmful contact between the upper and lower teeth. It stabilizes the jaw joint by guiding jaw muscles into a relaxing position, dissipating muscular tension. 2. Repositioning splints, also known as non-permissive or directive splints, have customized indentations designed to prevent the teeth from sliding side to side. This helps to reposition the jaw joint into its natural place by aligning the anatomical structures. 3. NTITSS is a special dental appliance consisting of a splint that fits over the front teeth, both lower and upper simultaneously. It should only be used for short periods to alleviate migraines caused by severe grinding or clenching. It is not recommended to be worn during sleep. Occlusal splint therapy is the best treatment option for mild, moderate, and severe cases of bruxism, since besides preventing damage to the anatomical structures, it also inhibits the chewing impulse that makes you grind your teeth while you are asleep. Mouthguards are also useful for sleep apnea. Sleep apnea is a disease in which breathing stops spontaneously while a person is sleeping. Various treatments exist for this condition, and dental splint therapy is one of the best support treatments to reduce symptoms. This is possible since occlusal splints adjust the jaw, tongue, and chewing muscles to their natural position and keep the airways open, improving breathing. When it comes to sleep apnea night guards, you should only wear FDA-approved custom-made guards provided by a specialist. There are currently 2 different types of mouthguards for sleep apnea. 1. Mandibular advancement devices. This is a splint that covers both the lower and the upper teeth and works by moving the jaw forward in order to open the airway. They are custom-made, and they will move the jaw more or less depending on each patient's needs. And 2. Tongue-retaining devices. These work by keeping the tongue in its place to prevent it from falling back into the airway once you fall asleep. They are not a main treatment option, but an alternative for people who can't use a mandibular advanced device. Mouthguards can also improve snoring since it is caused by a partial obstruction of the superior airways. It occurs during sleeping hours when your throat relaxes, causing it to close a bit, making it difficult for air to circulate normally. Wearing a mouthguard for sleeping can improve snoring by keeping the airway open. The types of occlusal splints used for snoring are the same used to treat sleep apnea, the mandibular advancement splint, and the tongue-retaining splint. And finally, we have sports mouthguards. These mouthguards cover your teeth and gums to keep you safe from suffering injuries while practicing contact sports like boxing, wrestling, or hockey. They can be custom-made at the dentist's office for a better fit. But in this case, over-the-counter mouthguards are efficient at keeping your teeth safe. Wearing an occlusal splint, especially while sleeping, offers a large number of benefits for our general health. It dissipates excessive tension by stimulating muscles and jaw relaxation. It reduces head, neck, and back pains significantly. The muscles have a property called muscle memory. The constant use of the splint allows the chewing muscles to remember the correct relaxation position. It prevents occlusal wear and dental enamel injuries such as fractures. And sleep quality is significantly improved by wearing a dental guard for sleeping. Custom-made night guards are completely safe. However, OTC night guards might cause some serious problems since these are not indicated or supervised by a professional. Some of these problems include worsening teeth grinding symptoms, headaches, neck pain, jaw pain, and TMJ disorders. Lastly, you should know the average cost of getting a night guard. Custom-made occlusal splints by the dentist cost around $200 and $1,000. It will vary depending on the severity of your symptoms. Slightly customizable night guards like the boil and bite guards cost around $20 to $200, and over-the-counter night guards cost from $5 to $50. Some insurance covers all or a part of the price of custom-made dental guards by the dentist, but others will not cover it, so you should check it up directly with your insurance company. This is it for today's video. Thanks for watching, like and subscribe for future oral health videos. Till the next time.